As a parent, you're basically building your child's future every single day. So today, we're going to talk about one of the most important parts of that foundation, their health. We're talking from day one all the way through those teenage years. Let's dive into how to build a healthy life right from the very beginning.
But here's the thing. It's the question that's always in the back of your mind, right? You see the scraped knees and you deal with the sniffles, but how do you really know that everything under the surface is on track? It's a worry every parent has, and believe me, there's a clear, proactive solution.
So here's our game plan for getting that peace of mind. We'll start with that big question every parent asks. Then we're going to peek behind the curtain of a health checkup. We'll get into the incredible power of prevention, and we'll talk about the key signs that tell you it's time for a visit. And finally, we'll see how you and your doctor are a team in all of this.
So let's start right there with that feeling of uncertainty. Look, it's totally normal. You see your kid growing every day, but what about the stuff you can't see? Our goal here is pretty simple. We want to help you shift from that nagging worry to a place of real, informed confidence.
And the solution? It's actually pretty straightforward, and it's incredibly powerful. Proactive, routine, pediatric care. See, this isn't about waiting for something to go wrong. It's about consistently checking in to make sure your child is absolutely thriving. This is the real answer to that big question we started with.
Okay, so what really goes on during one of these checkups? I promise you, it's way more than just a quick look over. Let's break down what's happening to show you just how thorough these visits are. Think of a checkup as a complete 360-degree view of your child's health. It all happens in 4 key stages. First, the doctor tracks their growth and makes sure they're hitting their developmental milestones. Then comes the hands-on physical exam, checking their vision, hearing, heart, and lungs. The third step is all about being proactive, screening for early signs of things like allergies or asthma. And finally, you get advice that's tailored specifically for your child's age.
And don't forget, these checkups are just as much for you as they are for your child. Seriously, it's your dedicated time to get an expert's advice on nutrition, sleep habits, even tough behaviors, the whole shebang. It's really an educational partnership.
This idea of being proactive brings us right to our next point, the awesome power of prevention. Honestly, the best way to think about it is like a shield, one that protects your child long before any danger even shows up.
So here's the big idea. Preventive care isn't about treating sickness, it's about creating health. It's a whole strategy to stop diseases before they even get a chance to start. And one of the most powerful tools we have in that strategy is immunization. And believe me, this shield is incredibly strong. We're not just talking about minor sniffles here. We're talking about serious, sometimes life-altering diseases like measles, polio, and hepatitis. The reason we don't see these as often anymore is because of effective vaccination programs. It is truly one of the greatest public health wins in history.
It all kind of boils down to this one simple truth. Staying up to date with vaccinations is one of the single most effective things you can do to protect your child's long-term health. It really doesn't get much clearer than that. It's an action you take today that pays off for their entire life.
Okay, so we've got the routine scheduled down. But when else should you pick up the phone and make an appointment? This next part is all about clear, actionable triggers so you know exactly when it's time to call.
So, when should you book that checkup? Well, the obvious times are when vaccinations are due or if it's just been over a year. But you should also give a call if you notice any delays in their development, if they seem to be getting sick all the time, or if you're getting ready for school or a big trip. And of course, if your child has a chronic condition like asthma, regular check-ins are absolutely crucial.
All right, this all leads us to our final and maybe most important point. Your healthcare provider is your partner in this. And to show you what that partnership looks like, let's just tackle some of the most common questions that parents have.
First up, the big one everyone asks. How often do we really need to be going in for these checkups?
Well, the answer actually changes as they grow up. For babies, you're going to be in there a lot more often, sometimes every few months, just to track all that rapid development. But for older kids and teens, an annual visit is usually the perfect rhythm to stay on top of their health. Okay, here's another one that comes up all the time. Can a child get more than one shot in a single visit? It's a common worry.
And the answer is a huge, confident yes. The science on this is crystal clear. It is absolutely safe to give multiple vaccines in one appointment. In fact, it's recommended. It's more efficient and it means less stress and fewer pokes for your little one.
But let's be real. Life happens. Schedules get crazy, and sometimes a vaccine appointment gets missed. So what do you do if you've fallen behind schedule? The most important thing here is don't panic.
There are well-established catch-up schedules designed for this exact situation. Just talk to your doctor. They will get you right back on track and make sure your child gets fully protected. No big deal. So at the end of the day, it really all comes down to a true partnership. You are the expert on your child. You see them every day. You're building those healthy habits at home. And your doctor? They bring the clinical expertise, the data tracking, and those vital protections like immunizations. You're a team working together for your child's health. I want to leave you with this really powerful idea. Just think about it. Every single stage of childhood is another chance to build a strong foundation for a lifetime of health. Every checkup, every conversation, every healthy choice, it's just another brick you're laying for their future. So we'll leave you with this question to think about. By being proactive, you're not just dealing with today's sniffles, you are actively building their future well-being. So what foundation for their health are you building today?